Good morning, good afternoon, and good evening, everybody, depending on where you are in the world. It's an absolute pleasure to be with you today. So I'm Kate Flemming, as Ella's very kindly introduced, and with me too today is Jane Noyes, and we're absolutely delighted to have this opportunity to introduce you to some qualitative research and qualitative evidence synthesis in this Cochrane series. Just to quickly say that both of us have no actual or potential conflicts of interest in relation to this presentation. So today, on the 28th of October, this is the first of a whole series around qualitative evidence synthesis. And Jane and I are privileged to be with you today to give you this introduction. We've got some dates set for the next 4 sessions in November, December and January, and you can see the programme there. So following on from today, on the 15th of November, is Dr. Andrew Booth, who's going to talk about question formulation and searching for qualitative evidence. And then beyond that, next year, into February, March, April and May, we've got further sessions planned. No exact dates yet, but please do keep your eyes open for those. So we're absolutely delighted to have this opportunity through Cochrane Live to be able to tell you more about qualitative evidence synthesis. This is something we've all been working with in the Cochrane Qualitative and Implementation Methods Group for well over a decade, and it's an absolute joy to be able to speak to everybody about it in such numbers now today. So what we wanted to do was a really quick poll just to see where you were all at in relation to qualitative evidence synthesis. So the poll is up now. Dario's very kindly put that up for us. And the questions there are, have you ever conducted a qualitative research or qualitative evidence synthesis? And you can see there's yes once, yes more than once, no, but I plan to, and no, I don't currently plan to. So 40% of you haven't done a qualitative evidence synthesis, but you plan to. So hopefully today will be really helpful for you in that planning. You've got nearly a third of you who have done more than one qualitative evidence synthesis. That's fantastic. So hopefully you'll be able to participate and ask questions. And some quarter of you have done one qualitative evidence synthesis. So that's fantastic. There's a few of you are here, not yet got any plans, but hopefully are interested enough that we'll be able to whet your appetite and give you some kind of background reading and some understanding as to what it is to help to be able to take this forward further. So first of all, this session was about what is qualitative research and also what is qualitative evidence synthesis. So we'll just quickly have a quick visit about what qualitative research is. And why it's important. So generally, and hopefully I'm probably thinking most of you on the call will have a general understanding about what qualitative research is. It's research that's generally interpretive, and what the purpose of it is to really develop understanding of and maybe explanation for behaviours, about experiences and about interactions of individuals, and particularly about context and perhaps also the social context in which these behaviours occur. And you'll hear quite a lot about context and understanding of context through this presentation today. So qualitative research uses a qualitative methodology and by which we mean both methods of data collection and data analysis, and perhaps an overarching philosophy as well. So methods of data collection include focus groups, they include interviews, they may include observations, and the kind of data you can get from those is in this blue box at the right, which can include text, and is most commonly, I would say, text, which can be quotes from participants, it can be quotes from authors' analysis and their own interpretation. It can be tables, but sometimes it can also be conceptual figures and images such as photographs and artwork. And there's certainly some particular qualitative methods that particularly look about interpretation of photography and photographs. So it's not all about text, but predominantly, I would say, the methods we've developed so far in qualitative evidence synthesis are pretty much around the analysis of text, more than any of those other things that we've talked about. So just to highlight for you a key paper for the session, and there's a list of resources again on the final slide, and also the slides will be available in the next couple of days, hopefully tomorrow, but certainly hopefully by the end of the week. There's this key paper for the session today is a paper that Jane and I wrote earlier this year that was published in the International Journal of Qualitative Methods, which was kind of a sort of taking stock type paper of which we call Qualitative Evidence Synthesis, Where Are We At? And it gives a really kind of concise overview, but quite a thorough overview of where we're at with qualitative evidence synthesis and the methods. So that kind of underpins what we're saying today. Another good resource for you, just to highlight at the moment, is the Cochrane Handbook. So within the systematic reviews of interventions, chapter 21, we're near the back, but we don't mind, is the chapter on qualitative evidence synthesis that we wrote. We only had sort of 5,000 words to put that all in together. So it is kind of a signposting chapter onto other publications that we've produced as well. And we have a list of those also at the end of the presentation. So what is qualitative evidence synthesis? What's kind of purpose of what we're here today for? So we've talked about qualitative research and primary qualitative research, but qualitative evidence synthesis is kind of the next level above that. So it's a type of systematic review, and I'm sure most of you are familiar with what a systematic review is, that it brings together the findings from these primary qualitative research studies, but in a very systematic way. So probably no surprise to you there as to what it is. But it's really helpful to look at the aim as well. And the aim is to arrive at new or enhanced understandings about what the particular topic or the phenomena that's under study or under review. And by that, we kind of think about those individual studies and how, when we pull them together, do we get a kind of a different or enhanced understanding that you couldn't get from just those individual studies on their own. So what we talk about is kind of the whole thing being more than the individual papers, is kind of greater than the sum of the parts. So what we've done when we've been developing the methods for conducting qualitative evidence synthesis over the last decade or so, what we've done, this has been against a backdrop of kind of increasing demand from particularly healthcare decision makers, but healthcare policy, social care decision makers, and guideline developers for evidence that goes really beyond that kind of what works type of evidence that we get from systematic reviews of randomized controlled trials and more quantitative data, by drawing on data from qualitative research. And as we talked about in the first slide, this is about exploring, it's about understanding people's experience, their views, and the context and how context it can influence and impact on that. So what might this have to offer for us? It can help us identify outcomes that aren't seen particularly maybe as important in a single qualitative study. So something might be a kind of a very minor finding in a single qualitative study or in a couple of single qualitative studies, but actually don't come across as a major finding in that study. But actually, when you pull the studies together, you can actually start to see that all these kind of small findings and small outcomes, when they're put together, actually become much more important. Something that may have been missed in an individual study, but once you pull together the studies in the synthesis, are seen as much more important. It also enables us to bring together multiple perspectives that you may not get in a single study. Traditionally, qualitative research, primary qualitative research, tends to have fairly small sample sizes. It can be difficult to get multiple perspectives in one study. It can be too expensive to run multiple studies to get the different perspectives, or to bring all those perspectives into one big study. So what we're enabled to do through qualitative evidence synthesis is to bring together those multiple perspectives around a particular topic or a particular area of interest. And that can include contradictory viewpoints that may equally not come together in a single study. We can get a more powerful explanation than is possible in a single qualitative study. And by this, we're not talking about the kind of power calculations you may be more familiar with regard in effectiveness reviews and randomized controlled trials. But actually what we're talking about is the power of individual voices coming through these primary qualitative research studies that are being pulled together. And quite a neat example of that I have been involved in is a qualitative evidence synthesis on women's views as to why they continue to smoke in pregnancy. So these are women who continue to smoke despite the health message and the understanding that it can be harmful. And why does that health behaviour continue to happen? We actually managed to pull together over 40 primary qualitative studies about that. Each of the individual studies didn't have that many women in it, but actually together and collectively, we had the voice of over 1,000 women in that qualitative evidence synthesis being represented, which gave us huge insight into why a particular health behaviour continued, and actually therefore how we can start to, in future, influence and have more impactful interventions to help support women to stop smoking in pregnancy. It can also help identify gaps in the evidence and reveal future research priorities, and that's very similar to what you'd expect from an effectiveness review. It can complement the findings of an effectiveness review in giving us that greater understanding as to why behaviours might happen, why interventions may or may not be effective, and also about implementation into practice. And equally, alongside this, can help inform the development and implementation of complex interventions. So just to build on this a little bit further, what purpose does this have? We can start to understand, particularly in relation to interventions of effectiveness, the kind of heterogeneity that can happen across interventions, about how acceptable an intervention may be, how feasible it is to implement that intervention in a particular context, how much of that intervention we might need, how far does the intervention need to reach to get maximum impact, etc., etc. And we can also begin to understand implementation of more complex health system level. So rather than sort of individual level interventions, but also health system level interventions and the complexity around those, and thinking about that, such as public health interventions. And some good examples we have around feedback loops, about how a system may need to adapt in response to a particular intervention that you're putting into it. And there's some lovely examples that we can see being enacted at the moment throughout the pandemic around actually what we do at a public health level and the implication of that on a health system. It can also help us develop patient-centered questions, or to better understand patient outcomes of interest when designing an intervention review. So these last 2 points are, well, this entire slide really is really looking at actually how qualitative evidence synthesis can really enhance our understanding and the applicability and the usability of effectiveness reviews. So it's that kind of real complementary and supporting, but equally informative role that qualitative evidence synthesis can have alongside systematic reviews of effectiveness. So just thinking now, what kind of questions can a qualitative evidence synthesis answer? So it can be undertaken as a standalone review project. It can look at how people experience illness or challenging life circumstances. It can particularly look at what the barriers and facilitators are around accessing healthcare. It can help us think about what impact do specific barriers and facilitators have on people on adopting interventions, experiences and behaviours. And so we've got some really nice examples of that coming up in a couple of slides' time as the type of questions that have been answered. But equally, as I've suggested already, that qualitative evidence synthesis can be linked to a review that assesses the effects of interventions. And that linking can help us understand why an intervention may or may not work, for who it might work, and in what circumstances might it work. Gives us that really the kind of much broader understanding and in-depth understanding of why things do or don't work, and where and how. It can help us understand as well how an intervention is experienced by all of those involved in developing it or delivering it or receiving it. So actually, what's it like to be on the receiving end of the intervention? And alongside that, actually, what aspects of an intervention are valued or aren't valued, and why? really important when you're trying to get things implemented into practice. And also looking at what factors facilitate or hinder successful implementation of a program or a service or a treatment, and does it need any adaptation for any form of large-scale rollout? So what might work in one context, what might we need to do to adapt an intervention in order for it to be applicable across a much larger rollout? Okay. So it can also help us explore diversity and equality. And this is where that element of understanding context comes in that I talked about earlier on. It can give a qualitative evidence synthesis can provide us a really good opportunity for the views of really diverse groups of people in different contexts to be brought together. And those people may have different access to healthcare, they may have different access to resources, but actually through a qualitative evidence synthesis, it can enable those voices to be heard and the views of those diverse groups to be heard. It can also help us understand the acceptability of an intervention within a particular group or across a particular set of individuals. How its implementation might be affected within a particular context and adaptations that may need to be made, and how to, particularly important, to maximise benefit and achieve equitable outcomes, and to get some of that understanding of actually what might seem to be an equitable intervention, an equal intervention, actually can cause inequity. So something that happens to everybody, actually we know where, for example, through COVID, actually, sort of the implementation of visiting restrictions in hospitals and particularly end of life seemed to be an equal intervention, as in this, everybody kind of had to adhere to the same circumstances and restrictions on visiting, but actually there was inequity there that actually impacted more on some groups than others. So that's that difference there of understanding equitable outcomes across what might seem to be an equal intervention. Also, you can get really good diversity of views through a qualitative evidence synthesis by pulling those different papers together to determine if an intervention is harmful or have unintended consequences for people in specific contexts. And also it can help us to understand at a system level how health systems with varying resources respond and adapt when an intervention is implemented. So that thing where we talked about actually what happens to a system if we put an intervention into it can help understand that too. Okay. So in amongst all of this, and hopefully this is starting to come through in what I'm saying, that a qualitative evidence synthesis can be helpful to explain complexity that can occur in relation to interventions. And what this slide here in particular is looking at, it can be really helpful and useful in guideline development. And as a methods group, we did a piece of work with the World Health Organization looking at helping how QES can help us understand complexity and context in guideline development. So looking at WHO guideline development and actually how complexity can be part of that and how we can help understand complexity. And the bullet points on that slide kind of highlight what I've talked about already in relation to guideline development. So just having a look now at the kind of questions that have been addressed, and these are all, as you can see, taken from existing published papers. And you can see the kind of the variety of both the journals that are publishing qualitative evidence syntheses out with of Cochrane, and the kind of questions that have been both asked and published through qualitative evidence synthesis. And increasingly over the past 5 or 6 years, there's been a real appetite from journals to receive qualitative evidence syntheses as part of their submissions, and a real encouraging kind of upward trend in publishing as well. So when Jane and I first started working in the area of qualitative evidence synthesis, this really wasn't the case, and Jane has been particularly helpful in Journal of Advanced Nursing Nursing as an editor there, in developing kind of the approach to publishing qualitative evidence syntheses to the point at which they're really widely accepted and used and really well cited and downloaded. So we know now that actually this is a great way to go with regard to publication, and it's so refreshing for us to see. So I've talked now for a good 20 minutes, and we just wanted to have a quick pause, and I'll go over to Jane, who's been monitoring the chat box for me, to see what kind of questions have come up. And is there anything, Jane, that we can address at this point?
Yeah, certainly is. Thanks so much, Kate. And I think that your initial presentation has so nicely clarified what qualitative evidence synthesis is or isn't. There was a question about whether qualitative evidence synthesis was the same as systematic review. And of course it is. It is a systematic review if you're using systematic principles and processes. But I do agree that there's a lot of confusion in the field, and you know, people probably don't realise that as a journal editor, when I get a qualitative evidence synthesis submitted, sometimes they're mislabeled. People have mistaken it for inclusion of quality of life measures as a qualitative evidence when it's not. In the original PRISMA flow diagram for reporting quantitative intervention effect reviews, it mentioned a qualitative synthesis using the same language but for a completely different meaning. And that original meaning in PRISMA is for a narrative synthesis when a meta-analysis isn't appropriate. So we've moved on from that language now. So a qualitative evidence synthesis only refers to the evidence that you've talked to. We had some other nice questions. People wanted the reference of your study that referred to the women and smoking. Okay. Mike asked to Kate, were they all really different women in the synthesis? Yes, they were. Yes. They weren't all the same. And that's one of the beauties of doing a qualitative evidence synthesis, incorporating the perspectives of women across a range of studies, is that you increase the number of women whose perspectives that you're giving. I've addressed whether it's a type of systematic review. Other questions include, so systematic review authors for qualitative research need to state their cultural background as they would expect the authors of the papers they're reviewing. Yes, there's a thing called reflexivity and the biases that people bring to qualitative research and qualitative evidence synthesis. So as a team, you all bring different perspectives and different biases, especially if you're multidisciplinary. So you do have to make your cultural background and your prior beliefs make them obvious and transparent, and any particular biases that you might have or preconceived ideas in your interpretation. So that's really important. So what else have we got? Are there any differences in terms of where qualitative systematic review proposals are registered? Well, yes and no. So we have Prospero, which is based at Cates University in York, which is the prospective registration database of systematic reviews. They tend to favour the more quantitative reviews. They need a health outcome, but we have registered some qualitative evidence syntheses there. My own journal, Journal of Advanced Nursing, we publish protocols, qualitative evidence synthesis protocols. And in the Cochrane library, it's the standard format. It's exactly the same that you publish an a priori protocol before you move on to your review. That's, although it's slightly different in terms of registration of qualitative evidence syntheses, the principle of transparency is the same. Kate, what distinguishes an integrative qualitative evidence synthesis? Because that's a bit of a dual term there, because an integrative review usually involves qualitative and quantitative. And one of the examples that you put up on the slide, Susan has picked up, is, well, what is it? What's an integrative qualitative synthesis? So maybe you'd like to have a look at that.
Yes, certainly. I'll briefly touch on that one, and looking at some of the other questions in the chat box are things that we will be covering in the next few slides. So I'll bring those, hopefully we'll answer some of those questions as well. I'm very grateful to Andrew for picking up questions around in the chat box too, around various references and feeding those in. So thank you very much, Andrew, for working in the background there on that too. So an integrative synthesis, the way we use that phrase is the way we interpret that, that it's the integration of qualitative and quantitative methods within, or qualitative and quantitative papers within one synthesis, so that you can have both the qualitative and the quantitative, and one may happen, you have a qualitative evidence synthesis undertaken, and then you might do a quantitative, you might do a quantitative synthesis and then a qualitative one, or you can run the two in parallel. And there is a session in this series on that. I think it's probably worth highlighting that today we're doing kind of this overview introduction, and the sessions that follow this one over the coming months look into each of these components in much more detail. So it looks like there's a real appetite to understand more about this. So we'll cover what we can today, but we just kind of urge you to come back to the other sessions also, so that you can get much more detail around each of these things that we're just kind of we can run a whole module on this,
sure.
And we've only got the hour today. So I'll continue on now in time, just in the kind of issue of time, and we'll come back to some of the other questions again at the end. But thank you, that's been a really helpful kind of quick look at some of the questions that are coming up, and some of the stuff around the terminology around metasynthesis I saw, and metaethnography, etc., are coming up in the slides in just a moment.